It's an honor to be presenting again at this Distinguished Speaker Series, for VaYU University. And my topic today is really looking at some research and science that's really based upon sort of applied yoga in applied settings and applied populations. And specifically, what I'm going to be addressing tonight is yoga in school and occupational settings. So we'll be looking at the rationale for yoga in these settings and looking at specific populations in both students and teachers, and then in occupational settings, workers who are in a variety of different occupational settings, including one that is well known at this point in time with the pandemic, which is healthcare workers. So let me begin, first of all, before we go into the practical applications, to really discuss sort of the underlying basics and the science for how yoga works, because this is really going to inform how yoga may be practical and suitable for these particular populations and the problems these populations face. And so the psychophysiology of yoga is a growing field. There's a lot of research on basic science telling us about how yoga works on the mind and body. And this is chapter 4 in our textbook, The Principles and Practice of Yoga in Healthcare, which is a review on the research and psychophysiology of yoga practices. And we've come quite a long way in research in this area. And it's allowed us to create this logic model in this slide, which really summarizes all of the different sort of mechanisms and actions that have research support. And it's also a way of us understanding all the different facets of how yoga may work on the mind and on the body. So when I'm talking about yoga, I'm not just talking about the postures and the exercises. Of course, that is the most obvious feature of yoga practice. But I am talking about traditional yoga practice, which is a multi-component practice that includes not just the postures and exercises, but also the breathing techniques or the pranayama practices, the deep relaxation practices in yoga, specifically things like shavasana and yoga nidra, and perhaps most importantly, the meditative component. In fact, for those of us who are scholars and researchers in yoga, an argument could be made is the meditation component of yoga is the most important, and that the physical components are there really to help support the meditative component. Now, through all 4 of these practices, either independently or together as a multi-component yoga practice, we're improving the physical level of functioning in our body. And I'm calling this box fitness. And we're improving things like flexibility, muscle strength, coordination, and balance. We're certainly improving respiratory function, both through the exercises and the breathing techniques. And this leads to an overall physical self-efficacy. And through the mind-body connection, whatever affects the body affects us mentally, so we're actually influencing psychological and emotional state as well when we address the body. Through all 4 of these practices, we're also affecting what we call self-regulation of internal state, both physical state and psychological emotional state. The ability of these training practices in yoga to allow us to change internal state. To change physiological regulation, things like the autonomic nervous system, things like our neurotransmitter levels, the different brain activation of different networks in the brain and how they interact with each other. And perhaps the most important self-regulation targets are of stress and emotion. And over time with yoga practice, that moves from stress regulation to the characteristic of resilience to stress, and from emotion regulation to emotional equanimity in the face of the ups and downs of emotions. And this leads us to an overall self-efficacy of our psychological functioning. It is largely through the meditative component that we're increasing what we call mind-body awareness. Meditation, most simply defined, is the engagement of attention on some kind of target in a non-analytical, passive, relaxed manner. So we're engaging the attention networks. And over time, as we do this and practice this, we come to have some degree of mastery over our thought processes. and we start to become more sensitive. We develop this increased mind-body awareness, this increased sensitivity, which has also been referred to as mindfulness, because of this engagement of the attention networks in the brain. And of course, attention networks in the brain are what's involved in cognition and concentration, which also improve. And then over time, as we learn how to focus our attention and engage the attention networks, we ultimately come to a transformation we call metacognition. The realization and understanding that although we have thought processes, we are beyond those thought processes. We are not our thoughts. We are above those thoughts, which is this idea of meta. And so this is allowing us to have mastery over our thoughts to a larger degree, self-regulation of our own thought processes, which means that we react differently to our own thought processes. And in fact, we have the capability during this process of actually changing our thought processes if we so wish. And then finally, through the meditative component, what happens typically over months and years of practice is that individuals during the yoga practices will experience these deep unitive states, experiences of transcendence, the flow state, which leads many people to a sort of a deeper transformation. And you've probably heard people say things like, yoga changed my life. It's that kind of a deep, profound change in life meaning and purpose that changes individuals' view of who they are, what their goals are in life. And I'm calling this box pure spirituality, this deeper experience of these deeper states. And one thing you can see from this model is we're making changes from the gross level of physical fitness, from muscle and connective tissue, to the deepest experiences that humans can have. And these arrows between the boxes are really there to say that all of these things are really interactive. Nothing is really separate in this mind-body continuum. This also represents very clearly the kind of research levels that we have. So we have a good deal of very objective, strong research measuring the changes in the physical body and in respiration with yoga practice. So this is very strong research evidence. And over the past 2 decades, with techniques like brain scans and molecular biological techniques and biochemical assays, we're starting to have a deep understanding of how self-regulation of internal state and the development of mind-body awareness and mindfulness are engaged. And we're starting to understand the neuroscience of these processes in a very clear way. And then the weakest part, it is possible to do this research, but not much has been done yet. But it is an area of growing interest. So ultimately, because of this broad spectrum of change, we're seeing changes with yoga practice in global human functionality. That includes improvements in physical and mental health and performance on the gross level, to the deeper skills and characteristics of stress and emotion regulation, awareness and mindfulness, and ultimately metacognition. And then ultimately over time, with even sort of months and years of practice in what might be called a yoga lifestyle, we see changes in positive behaviors, improvements in well-being, values, life purpose and meaning, and what we can refer to as pure spirituality. So this is what we're talking about when we talk about yoga, and we can look at this model and see what components are there that can be useful for different populations. And I'll be referring back to this model as we go through our talk and look at these different populations and these different venues in modern society. So let's talk about yoga in public school settings, and why should we have yoga in the public school settings? Well, I think the answer really comes in what's going on with our children and adolescents in modern society. And they are facing currently many, many challenges on the emotional and psychological level. This is mostly due to stress, because our society really doesn't have stress coping mechanisms that are taught. For young individuals, this comes from developmental, family issues, social issues, academic challenges, and societal issues. Stress is a major risk factor for mental health problems, which can be simply mild depression or clinically significant levels of depression, anxiety, which can lead to substance abuse and even trauma. There's also, due to this, behavioral problems, apathy, violence, social skills, bullying, absenteeism in our schools is very common these days. That can also then, of course, affect grades, and many students are dropping out of school, so this is another problem. Behavior can lead to changes in lifestyle, which has been manifesting now in epidemics of obesity and diabetes that are unprecedented. We're seeing high levels of obesity in our children and adolescents. And then it's also manifesting in attention problems like attention deficit disorder and attention deficit hyperactivity disorder, which really have become much more prevalent. So there's a host of problems that we see, and we can see this in some of the evidence. So the American Psychological Association has been doing an annual survey of chronic stress in the U.S. population. And a few years ago, they reported on one survey where they looked at children and adolescents that stress is taking a physical and emotional health toll on children. For example, children as young as 8 years old are reporting that they experience physical and emotional health consequences often associated with stress. And here are a number of quotes from a number of studies that have been looking at adolescent mental health. So from this paper in 2018, 10% of youths experience serious emotional disturbance with substantial impairment in one or more functional domains. In this paper from 2015, the prevalence of DSM disorders, these are clinically significant mental health conditions, have a combined overall rate of 23.7%. In other words, 1 in 4 adolescents had a disorder with impairment. So this is a highly significant fraction of the population that are experiencing serious mental health issues. And then from this paper in 2009, it really addresses this basis of where these problems might be coming from. The most consistent factors involve indicators of stress. And personal resources such as mastery enhance resilience to onset of these problems. So really the solution to a lot of this mental health problem is really addressed by the whole idea of coping with stress and enhancing resilience to stress. Now we can see this in these problems in the statistics. The National Youth Risk Behavior Survey in the United States covers a lot of behavioral issues with children and adolescents in modern society. This is just one of many of these behaviors that's been assessed, and this is the percentage of students who seriously considered attempting suicide. Overall, 17% of adolescents have seriously considered attempting suicide, and it's much more predominant in females, twice as much as in males. So, and really it's across all high school grades from 9th till 12th grade, and it's really prevalent in virtually all of the demographics, including the Blacks and Hispanics. So this is a very serious problem in our mental health in our children and adolescents. This study actually looked at children and followed them from ages 9 to 21 and looked at the cumulative possibility, the cumulative prevalence of the occurrence of a psychiatric problem. And the lifetime prevalence of psychiatric problems by age 21 well exceeds 80%. That's the odds that over that time period, a child will experience a clinically significant mental health condition. That suggests that the experience of psychiatric illness in our children and adolescents is nearly universal. This is really a stunning finding. And really a serious indictment of the problem. And most people are unaware of this serious problem, but if you talk to teachers or principals in schools, they immediately nod their heads in agreement because they experience this on a day-to-day level in the public school setting with their children and adolescents. Now, the problem with our school system is that it was developed at a time in the Industrial Revolution when the goal of the schools was to educate children so that they could get a job. So really that's been the focus. The focus has been on history, on science, on mathematics, on English, on all those subjects that can allow a child to become an adolescent and qualify for a job. But in that, there is no education of emotional learning, of stress management, of other skills, of just maintaining mental and physical health. And so this has been referred to as the factory model of education. The belief was that the back door of the school leads to the front door of the factory, and students should only be taught the essential skills required to become a successful factory worker. So the problem is that we have individuals who are coming out of our school system who are trained to get a job, but are suffering from all of these mental health and lifestyle issues. So this has been a problem, and it's been recognized as an issue. In fact, it was recognized as early as 1914 in this seminal book called The Hygiene of the School Child. It was predicted in that book that the health and welfare of a child will be regarded as one of as much importance as arithmetic and geography. So clearly that prediction has failed. That was 100 years ago. We still have not reached that point where we are looking in our schools to address the health and welfare of children. And it's been recognized by a number of organizations. This is the Center for Disease Control, who have argued for this model of the whole school, whole community, whole child model, so that it involves things like health education, physical activity, nutrition, health services, counseling, social and emotional climate, emotional employee wellness, and family engagement. And a more important one that's more specific is the Collaborative for Academic, Social, and Emotional Learning, which is called CASEL. And here they're talking about a number of skills that need to be implemented in school settings to produce this total child education. This includes things like self-awareness, self-management, responsible decision-making, relationship skills, and social awareness. And if you look at our logic model for yoga, you can see that a lot of the outcomes of yoga fit very well with a lot of the goals of social and emotional learning. So there's a good overlap between this movement and what yoga can provide. Now, we know that yoga is being used by children. I mean, if you go on to Amazon.com and just type in yoga and children, there are many, many books on this whole topic. And the prevalence of yoga practice in children is growing significantly, as it is in the adult population. So these are just examples of the many books that are out there for books on yoga for infants as well as adolescents. And it's not only for just healthy children. There are also books now that are looking at problems that children might have. So here you're seeing books that are looking at autistic child, yoga for the special child, and then yoga therapy for every special child. So the idea that yoga may help as a sort of a therapeutic intervention as well to address children who already have experienced some kind of mental health issues. Now, we know that this is effective because there's now a growing body of research that's been done on yoga for children in a clinical setting. And chapter 18 in our book, The Principles and Practice of Yoga in Healthcare, really summarizes this research as yoga therapy for pediatrics, summarizing the scientific rationale for why yoga could be effective for children and adolescents and their problems, and then summarizing the research evidence that was published up to the date of the book and the chapter. And we have other reviews. This is a review I was involved in that was just published very recently. It was a systematic review of randomized controlled trials testing the effects of yoga with youth. And what we found was that in all but 5 studies, yoga improved outcomes in at least one of the 3 domains of psychological, behavioral, cognitive functioning, or physiological, physical functioning. And results indicate growing evidence that yoga is a promising intervention for children and youth. And this review paper included a lot of studies that were done in yoga in school settings with children in the school setting. So we've also published a paper, and my lab has been very active in promoting this whole idea of the science behind yoga and why it's relevant for the school setting. And so we published this paper specifically for that purpose, a scientific rationale for why yoga belongs in the school setting. And in this paper, we summarize the problems that I've just shown you in the school settings. We've talked about the mechanisms of yoga, and then we summarize the research to date that's been done on yoga in public school settings. This has actually also become a movement. In fact, there are many yoga programs that have now been developed specifically for implementation in school settings. And what we did was we published a paper doing an analysis and a survey of trying to find these programs. And what we found, and this was published now 5 years ago, 36 programs we found. And these are standardized programs which have training programs for teachers, and they're going around the country implementing their programs in schools. And at that time, we found that these programs were offering yoga in more than 940 schools across the United States, and more than 5,400 instructors have been trained to offer those programs in yoga in educational settings. So this was a wake-up call that we intended to sort of make to the education community that yoga is something that's starting to be implemented in public schools. Another group that's been very active in this whole idea of promoting yoga in public school settings has been the Yoga Service Council. And the Yoga Service Council is really a group of yoga teachers and instructors who are really dedicated to providing yoga for special populations. And one of those is children and adolescents, and certainly in school settings. And so they published this book, which is available on Amazon.com. And for any yoga teacher who wants to approach this idea of teaching yoga in schools, this is really a how-to book. It's best practices for yoga in public schools. And it really goes step by step into how to engage students, how to engage the administrators in school settings to be successful in offering yoga in the school setting. And then finally, we've published this paper, which is really a review of the studies that have been done. Now, this is really a brand new area of research. There's not many studies published. At this point in time, when this paper was published in 2016, we had fewer than 50 studies done. So really, in the field of research and science, that is really very, very preliminary research. We need to be at the point where there are hundreds and potentially thousands of studies in order to have an impact on the education system to convince policymakers that yoga deserves to be implemented in school settings. Nevertheless, most of these studies did show positive benefits to some degree, but it's very preliminary work and needs to be expanded substantially. So, as I mentioned, there's less than 50 studies. Most of those have been done in elementary schools. Many of these studies are weak in that they didn't even use a control or comparison group, which is a strong experimental design. Many were after-school programs, which means students chose to go to that program, those programs, as opposed to all of the students being offered. So that's a selective population. A significant number of studies have actually had negative results, which is another indication of the infancy of this field. And a lot of these studies also had numerous other methodological weaknesses, small sample sizes, for example. But really, funding is the overriding challenge. It's difficult to get this research funded, and so it's a struggle to try and keep this research going and producing more studies. Nevertheless, it is growing. And what we see is that the growth has been really substantial since the year 2000. So these are all the studies in the purple curve here that have been published on yoga in public school settings. You can see virtually very little that's been done in the past. And really only the past 10, 15 years has seen this dramatic increase in the total number of studies. And the quality is also increasing. This orange curve represents the randomized control trial. So those have been increasing as well. So just to show you some examples of this, this is the Kripalu Center for Yoga and Health, which is the largest yoga center in the United States. They've developed their own program called Kripalu Yoga in schools, and they have a teacher training program, and they've been implementing yoga in public school settings. Now, I've worked with this Kripalu program for yoga in the schools, and we've done some preliminary studies. And this is a summary of the first few studies we did, looking at some of the mental health outcomes that we observed. And the way I've plotted this graph is to show improvement in the pink going to the right, and then worsening going to the left. And the pink represents the yoga group, and the blue represents the control condition, which was no treatment. And what you can see is that there's very little improvement in the yoga group. But what you can see for all of these metrics of social stress, attitude, anger, resilience, negative mood, anxiety, or anger, you can see that the control group is actually getting worse. And a lot of these studies were done over a course of a full semester, 3 to 4 months. So what we're seeing here is the actual deterioration in mental health that's actually occurring in the school setting. And what we're seeing here is that yoga is preventing that decline in mental health characteristics. And our prediction would be, these are short studies, semester-long studies. Our prediction would be that if we were able to apply this over years of school, over multiple years, we might see not just a sort of a breaking or stopping of this decline in mental health. We might actually see an improvement in some of these characteristics if yoga was more applied over the longer term. We've also seen this in things like grades. So for example, in this study in which yoga was applied in the school setting, the control condition is the dashed line here, and you can see this general decline in the cumulative grade point average as students go through the school year. And this is the yoga group in the solid line, and this area here is before the yoga intervention. During the yoga intervention, the grades were maintained. However, by the time we get to the end of the yoga intervention and the students presumably stop to a large degree practicing yoga, that decline once again falls into place. So once again, this is the same trend. We're seeing that yoga is acting as a brake on this psychological decline. We've also seen this in a study that was funded by the National Institute on Drug Abuse. And the goal of this study was to look at whether yoga could prevent the initiation of substance abuse. And substance abuse is known to start mostly in middle school in grades 7 and 8. So that's where we conducted this study. And we looked at a number of metrics of different sort of characteristics that are prone to having students engage in substance abuse. We found one outcome that was there from beginning of the program to the end of the program, and that was the willingness to smoke cigarettes. And what you can see in the control group that did not practice yoga is that they increased their willingness to smoke cigarettes by the end of the yoga, by the end of the time period that was part of the study. Whereas that the yoga group that was in the yoga program had much less increase in the willingness to smoke cigarettes. So once again, we're seeing this same phenomenon. We're seeing this prevention of a risk factor for substance abuse by applying yoga in the school setting. And I've also worked with another program called Yoga for Youth. And this is a Kundalini yoga-based program, which is the style of yoga that I'm expert in. And we started out looking at a study that was done in Los Angeles in a charter school. And this was just a single group trial. All of the students in this study practiced the yoga, and that's what we observed. And between the beginning and the end of the program, we saw a statistically significant improvement in perceived stress, which was reduced. We saw statistically significant improvement in resilience to stress. We also saw improvements in positive mood state, but in this particular study, we didn't see negative mood state change at all. So again, preliminary data, weak study because there's no control in this particular study. But these are the kinds of things that we try and get to do. This study was not funded at all, so it was really done on a volunteer basis. And so that's where we are when we're in the infancy of a new field. There's very little funding to get preliminary studies done. We continued with another Yoga for Youth program, which has just been published this year and very recently. And this was an after-school program done in North Carolina schools. And what we saw here was changes in the difficulties in emotion regulation scale, which is a reflection of the ability of children to regulate their emotional functioning. And everything that goes down in this particular scale is a positive change. So what you can see is the yoga group improving substantially in their emotion regulation, whereas the control group that did not practice the yoga was pretty much the same from before to after the treatment. Now, the best way to hear how the students are experiencing is to actually hear from the qualitative studies in which we interviewed the students in these studies what their experience was. And so, and I've broken this down in the logic model to show you how these different elements of the logic model actually manifest in real life. So I've selected these particular quotes to address these particular aspects of the logic model. So in terms of the physical component, what I'm calling fitness, one student said, "I like to run a lot, and it can usually go better when I feel flexible, and I've been feeling better when I run since practicing yoga." Another student said, "I think I've been sleeping deeper and more comfortably. I also do the 3-part breathing so that I can relax myself before I try and fall asleep." Now, in terms of self-regulation of stress and emotion, one student said, I felt like it was easier to calm myself if I was like nervous about something or just to deal with my stress. Another student said, before you're taking a test, relax and breathe, and you don't get as nervous or as tense. And then finally, I used breathing outside the classroom in my life to calm me down. If I was stressed or angry, I would then do the breathing to calm me down, and I will probably continue to do this. So this is a clear example of self-regulation of stress and emotion. These are skills that children learn virtually in their first yoga class and then immediately start applying this in their daily lives. In terms of mind-body awareness, one student said after the yoga program, I learned how to pay attention to how my body feels. This is the essence of this idea of mindfulness and mind-body awareness. We also call this interoception, the awareness of internal state. Another student said, yoga gave me a new perspective on my body, and I have more control than I thought I did. Another student said, I noticed myself changing, an increase in self-awareness, and it felt like instant gratification. So this idea of self-awareness, mind-body awareness, mindfulness. And then finally, I've been eating healthier, more fruits and vegetables, and not a lot of junk food, for example, ice cream and candy. Now, we didn't give these students dietary recommendations. So this behavior change likely came out of this increase in mindfulness. As you become more aware of the effects of your actions and the foods you eat, you then experience the negative benefits of negative foods and the positive benefits of positive foods. And here we're seeing this idea of a transition to healthier diet because of the awareness of the experience of how those foods affect you. And then finally, we didn't do these programs for a long time, so it's hard to see sort of these long-term changes, which typically are what's required to see changes in these deeper experiences. But one student said, I'm fascinated by the culture of yoga, how people can change their lives and help themselves physically, emotionally. I'm interested in learning more. So this is clearly someone who's now on a new trajectory to learning more about himself. And then we've had yoga, the Kripalu yoga program in one school for a number of years, and we did focus groups with some of the staff, and this was from the school counselor. And he said, yoga has made a huge impact on our school. It is making our school a better place. So as you change the individual, you change the school class, you change the grade, and then you change the entire behavior of the school. So this is how we go from the individual to the societal change, by changing individual functioning. Now, I think it's also important in education to address teachers, because teachers are also facing a number of issues with respect to their profession. And again, very similar titles that you see and issues that you see compared to children. Teachers are under enormous stress. It's a very stressful occupation. There's administrative burden. The school climate can contribute to that. Salary issues, academic advancement issues, grant support, excessive workload, work-life balance problems, which leads to this whole phenomenon of burnout that we'll be talking about. And that leads to mental health problems, depression and anxiety, physical health problems, the lack of exercise, and many teachers end up dropping out because of these really serious challenges. And that's reflected in real statistics. So this is from a paper that argues that the teacher shortage is real, large, and growing. The working conditions and other factors that are prompting teachers to quit and dissuading people from entering the profession, thus making it harder for school districts to retain and attract highly qualified teachers. Low pay, a challenging school environment, and weak professional development support and recognition. So clearly this is a very challenging profession. So we've applied the RISE program, which is a program developed by the Kripalu Center for Yoga and Health for workplace populations and settings. And this stands for Resilience, Integration, Self-Awareness, and Engagement. And they've targeted using the RISE program for stressful occupations like first responders, for educators, including teachers, and for health and human services. And so in some of our studies, we've looked at teacher populations. And so this is for education professionals. Most of these participants were teachers. What you can see is reductions. And this was a single group trial. After the yoga program, you can see reductions in perceived stress maintained at the long-term follow-up, improvements in resilience, at least by the end of the program, improvements in positive mood, reductions in negative mood state. And mindfulness tracks well with these improvements in stress and resilience. We see increases in mindfulness that were statistically significant and maintained over the long-term follow-up. And then other critical work factors like empowerment, self-compassion, satisfaction with life, professional efficacy, exhaustion, cynicism, and work engagement also showed some degree of improvement. So these are critical psychological issues that are contributing to this whole idea of burnout and teachers quitting the profession. Looking at another study, this was a randomized control trial in which we had a control group, and here you can see the RISE program on perceived stress. You can see the reduction by the end of the program, and then at the 2-month follow-up, there's statistically significant changes from the baseline, whereas the control group had no changes. In terms of resilience to stress, you can see by the long-term follow-up, there's actually an improvement in resilience in these teachers. Absolutely no change in the no treatment control condition. And then in terms of mindfulness, very clear improvement, statistically significant at both the end of the program and at the long-term follow-up. And again, no change in the control condition. This is critical because we're coming to the understanding that mindfulness is one of the mechanisms that is intimately tied with stress and resilience. In fact, these three factors move together. So whenever you see improvements in stress, resilience, mindfulness is also moving. And we believe that there's a mechanistic interaction here because you're learning to regulate your own thought processes, which is leading to this improvement in mindfulness. And the regulation of thought processes is the underpinning phenomenon behind stress and emotion regulation. So here is a negative mood state, positive mood state, self-compassion, and empowerment. All these other psychological characteristics in the randomized control trial also showing improvements. And just to show you the experience of teachers and how they describe it, one teacher said, "I'm a more effective and productive teacher." Another said, "I'm a much better teacher, more understanding, helpful, caring, and kind. I love my work more. It was so awesome." Another said, "I was able to connect with colleagues on a completely different level. Having them exposed to the benefits of yoga and the breath will make it just that much easier to share with other people in my school." Another said, "Before I attended the RISE immersion program at Kripalu, I was seriously considering leaving my job. After attending Kripalu, I felt a renewed sense of energy and purpose in myself and my work." And then finally, "Things at work have been difficult to the point that I was ready to transfer to another position. Instead, I have decided that I will stay and try to make things better by continuing to incorporate mindfulness and meditation on a daily basis with the students." So very clear changes that can be critical. And as you can see in these last two quotes, changes that made the difference between staying in the profession and leaving the profession. So finally, I want to bring us to the other topic of yoga in occupational settings. And this is basically an extension of what you see because school teachers are essentially in an occupational setting. But this is now showing data from other occupational settings. And there are workplace challenges that, of which a subset of these are experienced by teachers, but you see the same type of issues coming up: stress and resilience, burnout in the workplace, fatigue, mood and emotional disturbance, musculoskeletal conditions, particularly low back pain, changes, degradation in well-being and quality of life, behavioral problems, sleep disturbance, low levels of empowerment and creativity. And that can also affect other aspects of the corporate viewpoint in terms of the employer, loss of productivity, poor performance, low efficiency, absenteeism, presenteeism, a lot of job turnover, poor job satisfaction, poor relationships, inequality, and discrimination, which can be serious issues. Most of the studies so far have been addressing these psychological factors. And this is recognized by the World Health Organization that stress in the workplace is a serious concern and needs to be addressed. And we can see this also for the Center for Disease Control, the whole idea of stress at work, and that this is an issue that is becoming, needs to be addressed more effectively in our workers and in their occupational settings. So there is a body of yoga research that's been done, and it's growing. It's becoming more popular. This is one recent review, Yoga and Occupational Health. And in this paper, they concluded that our findings suggest that yoga has physical and psychological effects on workers from different professional categories. This is another paper, Yoga and the Workplace Outcomes, a systematic review. The findings of this study suggest that yoga has a positive effect on health in the workplace, particularly in reducing stress. So again, this stress is this underlying pillar that has effects on all of these other factors. This is looking at the effectiveness of spiritual intervention. And in this review, they looked at yoga interventions. Sub-analyses revealed that yoga was an effective intervention and that stress was reduced by these interventions. And their conclusion was that spiritual interventions in the workplace seem to be effective in improving workers' health. So just to give you some examples of research I've been involved with, this was a study done with a Drew Yoga program in Wales in the United Kingdom. And this was done in a clerical workers in a work building. And this was a randomized control trial. And you can see the mood states. The yoga group was in the black bars. So you can see improvements in all of these elements here, that yoga was showing improvements in a number of different metrics. And I draw your attention particularly to the two bottom graphs. The self-confidence during stress was increased in the yoga group, and the sense of life purpose and satisfaction, this deeper sense of job satisfaction being reflected in this. And then we did another study also in Wales and the UK with the same intervention, this time the perceived stress scale, which is the most widely used metric of perceived stress. And this was a randomized control trial. You can see the control group having virtually no change in perceived stress, where the yoga group had a statistically significant decline in perceived stress. The other thing that we saw in that same study was on the role and disability score, which measures one of the major issues in workers, which is low back pain. And what you can see is that the control group got worse in that study. The yoga group got statistically significantly better. So yoga is making an impact both on mental health as well as physical health. These are studies now done with the Kripalu RISE program. This was a mix of frontline professionals, 71 participants from education, healthcare, and corrections, prison work, in a 5-day residential Kripalu program. And here what you can see is by the end of the 1-week program, there's reductions in perceived stress and improvements in resilience. Well, that goes without saying because this is a yoga retreat center. However, the important thing is the long-term follow-up. This is 2 months later, after they're back in their home environment. The stress is still reduced below baseline, and the resilience is maintained at the long-term follow-up. And the same was true for mindfulness scores in that same group. So we saw improvements in mindfulness at the end of the week. Those stayed high at the 2-month follow-up once they were back in their work environment. Now, another issue is really burnout in physicians, and this has really become an issue with the pandemic. But even before the pandemic, this was a major issue in modern medicine. And these are headlines from all of the major medical journals. So this is from the Journal of the American Medical Association, the prevalence of burnout among physicians. The New England Journal of Medicine, physician burnout. From the Lancet, UK NHS staff, stressed, exhausted, burnt out. From the British Medical Journal, tackling burnout in UK trainee doctors is vital for a sustainable, safe, high-quality NHS. And this is from the Harvard School of Public Health. The prevalence of physician burnout has reached critical levels. Recent evidence indicates that nearly half of all physicians experience burnout in some form, and it appears to be getting worse. So it's a major issue. And we do have growing evidence now of yoga studies. So this is the use of yoga to manage stress and burnout in this review paper. And they concluded that yoga appears to be effective in the management of stress in healthcare workers. And this from my colleagues at Harvard Medical School. A growing body of clinical studies suggests that interventions including mindfulness, yoga, and mind-body skills training may be helpful in building the self-awareness and resilience needed for medical students, residents, and established physicians to mitigate burnout risk. This preliminary research likely played an essential role in Harvard Medical School's 2018 decision to now require all first-year yoga medical students to participate in a mind-body resiliency training program. And so this is a resiliency training program, the first of its kind, mandating resiliency training for first-year medical students, and yoga is part of that program. I teach chair yoga to these first-year yoga students, these first-year medical students, rather. And we've also now conducted studies on physicians themselves. And these are Harvard physicians based at Brigham and Women's Hospital. We did a single group trial with this group, and we looked at total burnout after a 6-week program that was offered at the hospital to these Harvard doctors. And what we saw was a statistically significant decline in the total burnout score. And then on subscales of work exhaustion, interpersonal disengagement, and professional fulfillment, we also saw improvements. And that went along with improvements in perceived stress, improvements in resilience to stress, and improvements again in mindfulness. We went further to look at Harvard resident physicians, and resident physicians are physicians in training. These physicians are even under more stress because of their work schedules. And it was difficult to get to these, but we had to offer this in the work setting. And what we saw again on the total burnout score was a statistically significant reduction. This was a randomized controlled trial. The control group had no change, but the burnout scores were maintained at long-term follow-up. And again, we saw on the total burnout scale, this reduction, work exhaustion, physician well-being, and interpersonal disengagement also were improved in the yoga group with this program. Looking also at perceived stress, resilience, mindfulness, again, these three track very well together, so we see these improvements again in these seminal constructs underpinning this whole idea of chronic stress and burnout. So by way of acknowledgement, I am funded and work with the International Association of Yoga Therapists, and I also work for the Kundalini Research Institute, which supports the style of yoga I practice. I'm also the director of yoga research for the Yoga Alliance, and our goal here is to provide yoga research literacy. So these are free access websites in which we have professionally produced yoga research videos of 7 minutes in duration. We have over 36 research webinars in which we've summarized the research on yoga in different populations, including all the populations I've described to you in this seminar. And we also have a collection of reprints that are easy access to be able to appeal to yoga teachers and practitioners to be able to access the actual research. And I conclude with this slide, which is really what we're looking at when we're talking about the importance of research and what this can do for society. So currently there's this broad increasing movement of practice in the grassroots level of people practicing in ashrams, studios, yoga centers, gyms, and spas. And what we are starting to see is this implementation of yoga into what I'm calling mainstream society, into our public schools, into the workplaces, and the healthcare system. And what is critical for this transformation and actually required by these institutions is the research. So that's why my focus in my career is on promoting the research in these areas. And my lab has done research on yoga for all three of these venues in modern society. And so with time, hopefully we will see that there's sufficient research to be able to justify the inclusion of yoga into all of our public schools, into the workplaces, and into the healthcare system. So I thank you for your attention, and I'm happy to address any questions.
Well, thanks a lot, Dr. Khalsa. I have no words. I don't think I ever realized how difficult or how widespread the issue of stress is in the school kids, in the teenagers, or this is truly astounding. So again, thanks a lot for this talk. I think it will probably open up eyes for a lot of us here who are obviously yoga practitioners, yoga enthusiasts, interested in utilizing yoga as a therapy, as a intervention method to help society in these things. So really appreciate that. There are a lot of questions in the Q&A box here. I think before I get into all of those, I would, looking at the questions and looking at the theme of those questions, one of the things I would just cue it up right at the top is that you talked about the lack of funding in how we are trying to address or propagate yoga at the school level. You also talked about being able to do that with some of the schools. If we had to go and propagate at a larger scale, beyond funding, what are the other impediments that you have seen? I think a lot of people have probably read the news about the Alabama state
Mhm.
allowing this,
Yeah.
right?
Yeah.
So, what are the things in your mind which will help us propagate it further?
Well, the only critical barrier is really the funding. Um, the schools are actually very open to this. We've had schools compete for us. We come in and
Mhm.
say we have the facility to provide yoga to you. We have funding to provide yoga and do the research on it. We've had schools compete for us because
Mhm.
they are so aware of the problems they're having, and they're quite happy to have yoga in the school settings. That's why yoga is becoming much more popular in the schools. There are schools, there are principals, there are districts in which there's this, I think, an unjustified argument that yoga is a religion, which I do not believe, and that is not true. Yoga is a mind-body practice. And when you look at that logic model, there's no belief in that logic model. It's all behavioral issues. You're modulating, you're moving the body, you're stretching the body, you're breathing, you're relaxing, and you're focusing your attention. There's nothing religious in that.
Mhm.
And so this is a misconception by many people in society who think that yoga is religion because it came from India. Well, I believe mathematics came from India, but nobody's arguing that mathematics is a religion. So, I mean, I think this really doesn't hold ground for me. There are schools in which they will not allow you to bring yoga into the school. So the Alabama situation, in which they're trying to change the law which prohibits yoga in schools, ultimately they will succeed. And the other reason that they will ultimately succeed is because yoga is becoming part of the mainstream.
Mhm.
14% in 2017 of US adults had practiced yoga in the past year, and that's growing exponentially. So eventually this is going to be a non-issue. So I don't think that's a challenge. The other challenge of yoga in public school settings is really a research design issue, because you're walking into a real life situation. And as a scientist, you like to have controlled conditions. And that's one place where you cannot control everything. And you're walking into their environment and you're trying to do research that's controlled. And now things happen in the school environment that are very difficult. Just to give you an example, some schools go on a rotating schedule of every 6 days. And then we had a school in which they had a snow day. And instead of continuing with the schedule, they shifted the entire schedule. And we had yoga teachers lined up for Monday, Tuesday, 5 o'clock, 3 o'clock, etc. And we had to change the entire schedule because of that snow day. So it's very challenging to do research in sort of a pragmatic, real life environment. So that's the other challenge to research in school settings.
And doing that all with minimal or no funding, I guess, is probably.
It's the funding can solve all of these problems. If you have enough funding, you can solve all of these problems, and I can guarantee that is the only real impediment to a lot of studies on yoga in schools.
Got it. Got it. One more question at a little higher level, because I'm seeing a lot of questions with that theme instead of addressing them individually. If folks want to, you know, figure out some way of collaborating with you or with some other organization who is doing this kind of work and take it to school boards in their local counties, in their local townships, is there any standard way of doing that, or would you suggest anything to that sort?
There really isn't a standard way. I mean, I would, if I was a yoga teacher that was interested in teaching yoga in schools, I would sort of align myself with one of the many, many yoga in schools programs that are out there. There are over 3 dozen, and you can just Google them online and you will find them. And there
Mhm.
will likely be programs in your region, in your area, and you can take a training program with that group to become trained in how to teach yoga in a school setting, because it's not easy to do. You can't just be a yoga teacher for adults and then walk into a school setting and expect to be successful. Teaching yoga to adults in a studio is very different than teaching yoga to children and adolescents in a school. So there's a lot of skills, special skills that you need to adopt. And a lot of these yoga and school training programs will give you those skills. And I would highly, highly recommend that book, Best Practices in Yoga in Schools, because that really is a summary of all of those issues that are critically important. So that's what I would recommend. And then in terms of approaching the schools, I mean, the best practices in yoga schools even provides advice on that element of how to work with the administrative levels. But really, you have to take a risk. You have to walk up to the principal, you have to walk up to the school and say, I'm interested in providing yoga to your school, and see what happens. And see how they react. And some will say, that's a religion, we can't do it. And some will say, when can you start? So it really varies.
Let me just push a little bit harder. I apologize for that. But is there any possibility of, because I see a lot of questions in the chat, is there any possibility for people to reach out to maybe Kripalu Center or to you directly and
Well, not reaching out to me. I'm just a single researcher. I'm not a coordinator of all of the yoga in schools research that's being done.
Absolutely.
So that would be inappropriate. What you can do is you can go online, you can find out who's done research in yoga. If you want to be specifically involved in research, you'll have to find a researcher who's done research on yoga in schools in your area, and then you can partner with that individual. If you simply want to teach yoga in public schools, then again, partner with a group that's already doing this, so that you have this sort of administrative background and group behind you, and that gives you some degree of credibility.
Absolutely. And yeah, I mean, I knew I was pushing it a bit harder. I just wanted to still ask that question. So thanks a lot for that, Dr. Khalsa. There is a question about, in the same spirit, in terms of the funding, do you have any kind of a ballpark figure, or do you have any estimate as to, if we wanted to, let's do it in one school or in one school district, how much should we be looking at? Is it?
So it depends upon many things. It depends upon what your sample size is. It depends upon how long the program is. The problem with funding research is that what you're paying for is labor. You're paying for the time of the principal investigator. You're paying for the time of the research assistants, and you're also paying for the yoga instructors to do the yoga instruction. So typically, you could say that if you wanted to do a semester-long or 2-semester program in one school, with 150 children or so, you'd need $150,000 a year, for example, in direct costs. It depends. I mean, if you have a faculty whose salary is already funded, you save that. Otherwise, if you have to pay half of the principal investigator's salary, that's going to be a large chunk of that money. Mm-hmm. You have to spend the money to pay the yoga teachers to teach the yoga classes. So these are the costs that involve. So it really varies depending upon who the staff is, whether they're already funded, and to what degree. Because in some faculty in some universities, their salaries are already fully covered. They don't need to worry about their salary. In many other environments, such as medical school environments in which I'm based, all of my salary comes from grants. So if I'm going to do a study, I need to be funded for part of my salary to do that study. And that's going to cost us substantially, because it's a significant fraction of my salary that has to go into that grant. So it really varies from circumstance to circumstance, the scope of the study you want to do, pilots, and just sort of from the main funding agency for biomedical research is the National Institutes of Health. They have sort of two programs. Mm-hmm. One is the level of preliminary studies, and that's typically a 3-year grant of $450,000. And then that allows you to do a decent study with a pilot population. Then if you want to do a bona fide, real-world, full, statistically significant study, that's so-called the R01 grant mechanism, and that's $1.25 million over 5 years. So that's the kind of level that we're looking at for either a pilot study or a major study.
Got it. Makes sense. Thank you. Dr. Khalsa, I'm seeing a lot of, so by the way, I see still a lot of questions on this topic. I would suggest that we take it offline at this point, because these are getting a little bit more detailed and very specific, especially for the folks who are already involved in the VaYU programs. I think we should take it offline and form maybe a smaller group to discuss it further. For those of you who are not already in the VaYU programs, I would suggest still reach out to one of us, and as we form that smaller group, we will make sure that we include you in there. And then as and when needed, we would obviously bring in experts and get more detailed information around it. It seems like a hot topic. It seems like a topic which a lot of us here are passionate about and want to do something about it. So let's let it not die down, I would say, right beyond just this webinar. Dr. Khalsa, there is another, I would say, theme emerging here in the questions, which is around the research methodology, the kind of variables that were used. There's a question about all of these variables seem to be very difficult to measure. How do you design your research around it and all those kind of things. So looking at these questions, I'm actually I cannot help myself, but at this point, just talk about a little bit about your upcoming course. I mentioned that a little bit in the beginning, but I know that you will be teaching a course in the fall, which is focused on biomedical science and research. So I would think that would be something that some of the folks who are interested in those uh, digging a little bit more deeper. I think some of those questions will get addressed in that course. So that would be something important to look into. Um, the other thing I would also mention is that it is my understanding that you will be mentoring or co-mentoring some of the doctoral candidates in the future at VaYU, right? I know some of my colleagues are already thinking about it. I see some of the questions in there, people saying that, here's my research interest and stuff like that. I know I'm personally also considering doing research in that area. So I was just wondering if we could, if you would like to throw some light on for folks who are for folks in my fellow student community, if they want to apply to be a PhD candidate, let's say under you as a guide, what would be your uh, guidance? What would be your advice for us to prepare ourselves, or how would you evaluate somebody if you would want, if we come to a point where you would accept them as your and you become their guide? How would you assess them? What would be the kind of things that they should have done or should be doing at this point, preparing for it?
So I think what any mentor would want to know in terms of a graduate program, and ask the student, and I can ask you this, is is there any specialization that you're pursuing it, or are you just interested in a general curriculum? What is your passion? What is your interest? What kind of direction? What kind of topic are you interested in studying?
Well, so I can I can be a guinea pig for others maybe at this point, right? So I'll tell you that at least from a VaYU MS program that I am doing in yoga therapy, there are three different specializations that they offer, or three different tracks as they call it, right? So I have not yet decided which one I'm going to pursue totally, but I would actually be very interested in knowing how I can customize my studies so that I can do that. So in terms of if you'll see different tracks that they offer currently, you have a yoga therapy course that they offer specialization. There is a track for research. So I would be interested in knowing how should I do that. But at this point, I am personally at least looking at it more as a generalization. But I would be happy to do something if you have a suggestion around it.
So the other issue that I would address is to make sure that whoever is coming into my mentorship, if I was the mentor, I would want to make sure that that individual had previous training or lectures or coursework in understanding the history and the philosophy and the practice of yoga, because that's fundamental.
Right. So yoga philosophy is one of the tracks that the MS program offers actually. So we have yoga philosophy, you have research, and you have yoga therapy. Those are the three specializations or three tracks that we have. We do have courses on yoga philosophy. Actually, those are probably my favorite courses, really, right? We had courses on the ancient texts of yoga. We had courses on the philosophy of yoga, especially when it comes to yoga therapy, right? What is the fundamental yoga principles which can be utilized for the therapeutic purposes. So yes, we do have some of those courses. We learned about the ancient texts. We learned what are the uh, underpinnings, not only from the perspective of the yoga texts that are very famous, something like Hatha Yoga Pradipika or Patanjali Sutras, but also the Vedantic or the Upanishadic underpinnings of those, right? And again, not to get into the religion of it, but how were those derived? What are the underpinnings of it? How do you design a protocol? Let's say if you are looking at understanding the mind-body complex, not just the body of a person. So yes, I think that is something that I would be able to say that yes, we learned that as part of this course.
Yeah, of course, the other thing in moving from a master's program now to a PhD program where you're now going to really be addressing research in a bigger way, I would want to know that you have had coursework or a solid and basic understanding of biomedical research in general. This would include how to access research, how to interpret research studies, a good knowledge of research design and research biostatistics in terms of understanding fully what's involved in a research study.
Oh, I see. Okay. So answer to that question, Dr. Khalsa, is an unequivocal yes, a big yes. And I would, this is probably an opportunity time for a big shout out to our instructor, Dr. Juduji. I think, it's something that I enjoyed a lot. This is a course that I'm just fresh off. It was done in the spring this year. We did learn about not only the biostatistical methods, but research designs. We learned about how to write good synopsis, how to research, different ways of writing synopsis and different ways of presenting our research. So that was a very extensive program. I enjoyed it thoroughly. I know that going back to school after 20 years, it was a little bit of a stretch to go back to all the statistics and having to learn all of that. Different softwares that are used for doing these kind of statistical analysis. So yes, that I think that is something that I could say that this is something that the MS program really imbibed in us, and I would feel confident that for a PhD program, I at least won't be starting from scratch. So yes, the answer to that would be
And then the final thing I would do is in terms of evaluating someone who wanted to go into a PhD program, I would really want to sort of get into the depth of why that individual would want to go for a PhD, because this is a major life commitment. They're going to be spending another 4 to 5 years. This is going to really reflect what their future goals are. So really this issue of conveying the enormity of moving to a PhD program and understanding why the individual wants to do that to ensure that it's a good fit. And this is important because you don't want to go into something which is a commitment like this without really having a solid foundation behind you in terms of your goals in life.
Okay. Right. I get exactly where you're coming from on that. So I would say that the MS program itself, most of us being working professionals and doing that, has definitely been a revelation to me, I would say, actually personally. And when I'm saying that, I think I'm speaking for most of my fellow students, right? We had to spend at least half a day for both the weekend days, like Saturdays and Sundays, joining the office hours, and then we had to study at anywhere between, I would say, 7 to 10 hours during the week time. So you are looking at a commitment of 2.5 hours every day, just going through the course material, preparing ourselves for the office hours, reviewing the office hours from the previous week. So I think I would say that most of us would know what it takes to spend that kind of time, like 15 to 20 hours every week cumulatively. I don't know whether that would be sufficient for a research program or not, but that is the experience that we have so far. And I think that would prepare us to take that call, assuming that that is sufficient for a PhD program, right? Again, most of us are working professionals, so that's something that I believe we all have to. And doing that, having done it for last 1 year and obviously already committed to do that for another year, I think it would give at least me a good yardstick or a benchmark to figure out whether I want to do it for another 4 or 5 years or not. At this time, I will tell you that at least I'm committed to do that. I know some of my colleagues are committed to do that as well. But do you think that's in the ballpark, like about 20-25 hours in a week?
Yeah, I mean, it really depends upon the project and the nature of the work. But it sounds to me like the sort of the coursework that's involved in the MS program is quite adequate for preparing students if they wish to move on to a PhD program. And so I'm very impressed with the setup that's there for the coursework and the prerequisites that are involved in moving forward.
Sounds great. Okay. Well, I felt like being on a hot seat after a long time. It almost felt like an interview. But thanks a lot, Dr. Khalsa. I think that was very enlightening. I know that the my fellow students who are thinking about that kind of thing, they will appreciate the insights that you have given. I'll go back to some of the other questions that are there in chat if time permits. I think let me just take a couple of more. Uh, there was, I think, a mention of 940 schools in US that have yoga programs. Do we have a list on any website so that one can connect with them to
So the only way to access those is to go to the individual programs and go to their websites. And that's going to vary widely. I mean, these programs will advertise themselves and say, we have yoga in 100 schools, we have trained 500 teachers, et cetera, et cetera. And that's going to vary from website to website, from yoga program to yoga program. And as I say, there's 36 of these programs. That was in 2015, 2016, and it's grown likely since then. So there is a lot of opportunities to join up with one of these programs, especially a program that might be in your city or region. And then, investigate them. You can talk to them, you can email them, you can possibly take their program and then go from there. I think that's the best way to get involved. It's as opposed to sort of going out on your own and trying to do this by yourself. It's best to work within the construct of a group of individuals that is all working in the same direction for a yoga in schools program.
Gotcha. There's a question on the course that you will be teaching in the fall. So I'll just quickly share my screen. This is a course YMS 501T, Yoga, Biomedical Science and Research. That's the program. That's the course that Dr. Khalsa will be teaching. So yeah, if you're interested, please reach back out to us, and we'll provide more information about it. So we are right at the time. I would say if there are more questions, we can always take them. But Dr. Khalsa, I don't know if you have a hard stop at this point. If you do, I think from a theme perspective, I have covered most of the questions. Some of them, as I said, are very detailed, essentially when it comes to how do we work with the schools. And I would definitely encourage that we take those offline, create a smaller group and discuss those more in detail separately.
I'm happy to stay on or to stop at this point. I'm happy to continue.
Thank you. That's awesome. So I would I would just take maybe a couple of more minutes to talk about the VaYU MS program, since we have already discussed most of it, with me as the guinea pig to talk about what all we have learned and what kind of courses the VaYU MS program offers. I think I've covered most of the information related to the program. The only thing I would add is that, as I already said, it is a fairly intense program. It's a graduate standard program. So, those of you who are interested in it obviously need to keep that in mind. I already talked about the time investment. I talked about the different courses that are being offered as part of that program. The only other, I think, couple of relevant things are that, it is a 4-semester program, runs for about 18 to 20 months, I would say. You, as I already said, you have office hours during the weekends, and you get material to review, study, and prepare yourself offline during the week time. Requires anywhere between, I would say, 6 to 10 hours every week to do that, based on my personal experience. It's a 30 credit course, and the financial investment is about $18,000 to $19,000, which does not include 2 of the PCP programs, which are the personal contact program, which happens in the first and the third semester of the program, where you have to travel to the LA center of VaYU, and it's a 1-week in-person yoga, study and practice, right? So that is separate. Your travel cost and your lodging cost and stuff like that. But other than that, the financial investment turns out to be somewhere around $18,000 to $19,000. So that's the kind of thing that you're looking at. I do believe that it's the time investment which is probably more significant than the financial investment, right? So again, if you have any questions on the program itself, shoot it out in the Q&A box. So we'll take that. If you have any further questions for Dr. Khalsa, who has thankfully agreed to stick around for some more time, would be happy to take those as well. With that, let me just see if there are any other specific questions that we could talk about here. We talked about the funding. We have talked about how to approach the schools. Here is one. What is Kripalu yoga and how is it different from other styles of yoga? And how does the research on Kripalu style yoga apply to the other styles of yoga? Interesting.
There are many, many, many styles of yoga. I know that this is not so true in India, but in the United States, we have definitely different schools of yoga. There's the Iyengar school of yoga, there's integral yoga, there's Kundalini yoga, there's Kripalu yoga. The list goes on and on. And these are styles from individual yoga masters. They are very similar to each other. They vary in emphasis from style to style. And you can find out what these emphases are. You can look at these different styles. There's many articles online that really define how these styles differ from each other. Some of them focused more on the asanas. Some of them are much more focused on the meditative practices. Some are focused on putting them all together. So it really varies. Kripalu is just another style. It is a contemplative style that incorporates all those four components of postures, breathing, relaxation, and meditation. And I consider that sort of the fundamental core of what I would call traditional yoga practices. There are other yoga styles that are much more focused on alignment and posture. And so those are the differences. There are a number of major styles in the US, and I know that this is very different in India, where there are schools there as well. So for example, if you've been with the Vivekananda Research Foundation, SVASA, out of Bangalore, they have a particular way of teaching. Yes. The Kaivalya Dhamma Research Institute has their particular way of teaching yoga. If you go to Patanjali Yoga Peeth, you will study under Swami Ramdev's method of teaching. There are new schools. The Sri Sri Ravi Shankar in the Art of Living has their program. The Sadhguru has his program in Coimbatore, which is now becoming international. All of these styles of yoga are very different, but they all cover much in the same way of very similar types of postures, etc., exercises, breathing, meditation. And the differences are more in the subtleties and the emphasis.
All right. That's perfect. There is another interesting question. Why does Harvard Medical School call mind-body resilience program instead of a yoga program?
Because yoga is a very small part of it. And their focus is on resilience, however you can develop it. So the resiliency program, yoga is just one offering. The other offerings are nutrition, cognitive behavioral therapy, mindfulness, creative writing, any other kind of strategy that can improve stress management and resilience is incorporated into that. And the idea is to give the students a choice. And the students are required to go through 3 of those programs. There's about 24 of these programs. Yoga is 2 of them. Yoga's in 2 of them. I teach one of the yoga ones, and another person teaches another yoga session. So 2 out of the 24 are yoga. Other ones are meditative practices and all those other types of mind-body practices. So it's not a yoga program. It's a resiliency program. And yoga, I believe, is probably superior to some of the others because yoga incorporates meditation. So it's better than meditation alone, in my view. But that is the strategy that's being used, and it's a strategy that allows more faculty to be involved and more choice on the part of the students.
Makes sense. There's another question. I think we covered it from an overall perspective, but since we are here and you have some more time, I would like to get a little bit deeper into it. How does one get buy-in from the curriculum developers in the schools? Like we talked about approaching the schools and presenting yoga as a intervention to them, but when it comes to curriculums, right? And
right,
how do we do that?
So this is a practical issue. Where are you going to put the yoga? how you're going to teach the yoga, where you're going to put it in the curriculum. You want it in the curriculum. Otherwise, it has to be an after-school program. And the problem with an after-school program is that's by choice. Students don't have to stay going through an after-school program, so that's done by choice. So what you end up with in an after-school program is those children who have elected to practice yoga. And so that raises an issue of bias. And the argument from a critic would be, oh yes, well they chose to practice yoga, so they were invested in it. That's why you're seeing benefit. It's not the yoga, it's the fact that they're doing something that they wanted to do. And so what you want is you want it to be in the curriculum so all of the students have it as a mandatory program. So first of all, the school has to agree to that. The school has to agree that all of the students in the class will take yoga. So then the second practical question is, where in the curriculum do you put it? You can't stop teaching mathematics and give yoga instead. But what you can do is perhaps for a semester, stop physical education classes. And instead of doing sports and physical education and jogging, etc., you do yoga. And that's one thing that we've done successfully. We've replaced physical education for an entire semester with yoga classes. And then compared it with a subgroup of students in the same school who continued with the regular physical education classes. So we were comparing the yoga intervention as compared to the physical education classes. So that's another way to do it. Another place that you could put yoga into is that a lot of schools now have what are called well-being classes or wellness classes. And these may be 1 or 2 classes per week. So that's something else that you could replace with yoga. And so you'd be comparing yoga with a number of classes to those who have continued with the wellness program. And then you'd say, you know, did the yoga program do better than wellness in terms of making these changes? Otherwise, it's very difficult to put something into the school curriculum because you have to have a space. That means you have to have a room that can that can be suitable for yoga classes. Mostly in school settings, that's going to be the gym, so the gym has to be available. That's why the physical fitness is a good place, or the physical education class is a good replacement because they have the room for this. The other way you can do is basically not do full yoga classes and do short sessions. So you do 15 minutes of chair yoga at the beginning of the day, 15 minutes of chair yoga at the end of the day, and do it maybe 3-4 days a week. And so give small doses of yoga in appropriate places where you can squeeze it in to the curriculum. But this is a major challenge, and you have to work with the school to really identify how you can get the study done. And this all comes in the discussion phase. Once the school is agreed to implementing yoga, then you have to sit down with the school administrators and say, how are we going to do this? Where are we going to put the yoga? And that's a lot of practical stuff that really takes a lot of logistics to work out the details. And there's no easy way around that because it's their environment, it's their curriculum, and you have to do the research within that constraint.
Interesting. I really like that idea of replacing or providing that as an option compared to some of the standard physical education wellness kind of programs, because I think by design it provides you a yoga and a control group as well, right? So it's a great way to do that if you are able to do it. I definitely don't want to impose, Dr. Khalsa. I know we are over time, so just let us know when you need to go, and we will stop right there. But since we have you here, let me just plug in one more question which has come in, and I find it very interesting too. From a research perspective, how do you define spirituality? Spirituality by its own nature means different things to different people, right? How do you define it? How do you measure it? And how do you differentiate it from mindfulness?
Well, mindfulness is a cognitive construct. Spirituality, in my view, involves a deeper experience. It's not just mindfulness. Spirituality is a deeper, profound experience. And the best way to conceptualize this is the sense of a unitive experience. In yoga, we call this samadhi. And this is well known in philosophy. There's a whole philosophy field called mysticism, which is an analysis of this whole phenomenon. It is a real phenomenon. In fact, it's a central nervous system phenomenon. It's well known. And we know that a number of different types of contemplative practices will lead to these contemplative states. these unitive states of consciousness. It's an experience of everything as one. It's also been called a non-dual state, because in our everyday lives, we go along in our everyday lives and we perceive the outside world and we perceive ourselves, and these are separate. But in this unitive state, everything is one. And that is the clearest way you can describe that sort of spiritual state is the state of oneness. There's no distinction between yourself and other. So in the example of the flow state for music performers, when a music performer is in this flow state, in that immersive state, that performer cannot distinguish between the music, the instrument, and the performer. It is all completely one. And it's a very profound and elevating state associated with a lot of positive psychological experience, a sense of calmness, a sense of peace, a sense of bliss. These are kinds of words that people experience in terms of the emotional states that are associated with this deep, profound state of consciousness. And it is possible to do this research on this area. Many people have said, oh, spirituality is so big and so deep, you can't possibly study it with science. And I completely disagree with that. If you can describe a psychological state, you can study it. All psychological research is based upon questionnaires that describe a certain state. So there's no biometric blood sample for depression. There's no blood sample you can take to determine whether somebody has anxiety disorder. This is all based upon experiences, and these experiences are embedded in questionnaires, which give you a score as to what degree those symptoms exist, and in the case of spirituality or positive psychology, the degree to which happiness is experienced, bliss is experienced, etc., etc. So it's absolutely possible to do this research. But again, it's very difficult to get this research funded because most of the research is really focused on practical application of yoga for depression, yoga for anxiety, yoga for diabetes, etc., etc. And we know that this is a biological state because we can trigger this unitive experience artificially through psychedelic drugs. So there's a whole body of research, for example, on psilocybin. And these individuals who are in these studies experience that unitive state of consciousness. It triggers the same regions of the brain that are triggered naturally through yoga and meditative and contemplative practices. And the experiences that these people have are identical. Now, I'm not advocating that people should take psilocybin. I think that there's a risk in taking drugs to achieve these states. It is much more reasonable and safer to achieve these states through the training that's involved in contemplative practices to prepare you for experiencing these states. But these are biological experiences. They're biological states. You trigger regions of the brain that give you this deep unitive state of consciousness. That, to me, is the underpinning of what I'm calling spirituality. Now, it's very important to distinguish spirituality from religiosity. That's why I'm arguing that yoga is not a religion. It does produce spirituality, but there's no dogma involved. The difference between a religion and spirituality is that religion is a set of dogma, it's a set of beliefs. If you belong to a religion, you accept those beliefs, you identify with those beliefs, there's a dogma associated with that. In yoga and meditative and contemplative practices, belief is not required. Absolutely. In fact, you can believe that yoga does not work, but when you practice it, you will still have those experiences. So that's the distinction between religion and spirituality. Spirituality is experience-based. Religion is more dogma-based. So I hope that makes it clear.
It does. It does. No, that's very interesting. I was actually quite intrigued by the statement that you made, Dr. Khalsa, that samadhi is a central nervous system phenomenon and it is well known. Probably a topic for another day. We are already way ahead of the time, so I don't want to impose too much on you. But that is something that really caught my attention, and I would be very, very intrigued by that. So with that, I think as I said, we are 15 minutes over. I don't want to impose on anybody else's time. People need to go. Probably it's a long weekend. So before we close, I just wanted to quickly let you know that if you want to, find more information about the VaYU MS program, please do visit our website. It's www.vayuusa.org. Please do note 2 U's out there. one at the end of VaYU and one at the start of USA. So that's our website. If you want to reach out to somebody directly, there is an email ID, apply@vyuusa.org. So you could write to that email, and we would be very prompt in answering you any questions that you have about the MS program.